they were that are used as anticonvulsants. Hydatins, which are used as anticonvulsants, and succinamides, okay? So these are all different classes of medicines that are used as anticonvulsants, under that big category of anticonvulsants. But there are also another type of drug too, okay? All right, so anti means none, convulse is a seizure, so anticonvulsants. These are used for seizure control. Okay, we're gonna look at adverse reactions by class. All right, so this one is harder to learn. It's gonna take more time to learn, okay? Barbiturates can cause drowsiness, excessive dreaming, and it's weird dreams, dependence or addiction. And you can die if you overdose on a barbiturate. They can also cause restlessness, excitement, lethargy. What's photosensitivity? Sensitivity to sun. Muscle and joint pain, and gangrene can result if it infiltrates into a tissue. Like your IV pushing it and the IV is not in a vein and it infiltrates into the surrounding tissue, gangrene. And that kills the tissue, it's gonna slough off. Okay? So then benzodiazepines, highly addictive, we've already learned that in mental health. They can lower the blood pressure, decrease respirations, also blur vision, cause flushing, which is redness, slurred speech, rash, joint pains, and burning eyes. All right, your hydatins, this is dilantin, which is the most commonly known in a convulsant, okay? This is the class. All right, gingival, what does gingia mean? All right, the gums, right. And hyperplasia is overgrowth. Gingival hyperplasia is overgrowth of the gums, especially if they're start taking it and they're less than 23 years of age. Y'all, the gums actually grow over the teeth. And they have to see an oral surgeon and have surgery and have the gums cut back off. We had a patient like that in the nursing home. And she had to go to the oral surgeon and have the gums cut back. And she was an LPN and she let some of my students go with her. They were just gonna be gone a couple hours, so I let the students go. Okay, and watch it. All right. Okay, coarse facial features can look more masculine than feminine. Excessive body hair growth, and then impaired physical and mental growth. So dilantin isn't an innocent drug, okay? Succinamides, this is really different. They can make urine look pink, red, or brownish red. I'd wanna know that, wouldn't you? All right, drug interactions can interact with numerous drugs, and so we're not even going there. You just need to look it up and see. So, assessment, okay? When a patient has a seizure, the doctor being able to pinpoint what part of the brain it occurs in can be greatly helped by a thorough assessment by the nurse of the seizure. When a patient has a seizure, that's your most important job, is to observe it. We don't put a bite stick in their mouth anymore to keep them from swallowing the tongue. We don't do that. So you time it and you observe it. You look at a clock or look at your watch. So you want to provide privacy, okay? As a school nurse, I had a teenager that had seizures. So when he started seizuring, the school nurse knew the teacher knew to clear out the room and send for me, okay? So they don't get embarrassed. People don't make fun of them. All right, so you're gonna look, if you're in the room, you're gonna look and see where the seizure starts. Does it start by the shoulder twitching? Does it start by the eyes looking up? Where in the body does it start, okay? And what parts of the body are involved? Because focalized seizures can just involve one part of the body, like the shoulder just keeps, moving. But a true grand mal seizure, it involves the entire body. okay? Look and see how long each phase lasts, if there are tonic and clonic phases. Tonic and clonic phases are phases, and this is like with grandma, where they contract, the whole body's contracting and the stretcher or the bed's shaking, and then they stop. And then they start contracting again. So you need to time each one of those. Even if you don't have time to look at your watch, 1, 1,000, 2, 1,000. Okay, and I'll tell you how many seconds it lasted. All right, and then when it's over with, you look and see, okay, so it's lasted 45 seconds, the whole seizure. And tonic-clonic phases were about 10 seconds each. Okay, so that's real important. But when it's over with, ask your orientation questions. Do you know where you are? Do you know what day it is? Do you know where you are? That's what I would ask my teenager, okay? And many patients, when they have a seizure, lose bowel and bladder control. So they're gonna urinate and defecate on themselves. Now, how embarrassing would that be for a teenager? And that's what happened to him, and I have to get him out of the room where nobody could see, and then his parents would come get him, okay? This careful assessment, again, can help with determining where the seizures are coming from and how they need to be treated. So a big part of this handout is learning how to assess a seizure in a patient, okay? All right, nursing diagnosis that would be relevant, risk for injury related to seizure activity. Know the route for your medicine under planning, know the route for the medicine that you're given. Dilantin can be given IV, but you can't give it IV. I want you to write that in. You can never give IV push Dilantin. It requires advanced interpretation, and you can't give it. If a patient's gonna be given IV push Dilantin, they have to be hooked to telemetry. And you have to run a strip before you push the Dilantin, while you're pushing the Dilantin, and after you push the Dilantin. And those strips have to be interpreted. And that's not within, they say that's not within your role, okay? Now, how does a doctor know how much Dilantin to give somebody? Because when teenage girls start their period and you have all those hormone changes, the dosage usually has to be corrected. So, just like with Lanoxin or other drugs that we've talked about, you can draw blood and run a Dilantin level. And if the Dilantin level is below the therapeutic range, remember, the doctor needs to increase the dose, right? If it's above therapeutic range, they need to decrease the dose, okay? Other planning, know that some of your anticonvulsants are controlled substances. They've got to be obtained from the Pyxis, and you have to do a count, just like you would do with Demerol. These include your barbiturates and your benzodiazepines. Implementation, make sure the IV's in the veins if you push anything, because it can cause gangrene. Now, even if you've got PO anticonvulsants, like you got a patient on PO Dilantin, you better tell your instructor right off the bat, because you need to be the first one to give meds. Because your seizure medications have to be given on time, or your blood level can drop and the patient can have a seizure, just because you're late giving them the medicine. Okay? So if you get called and your patient's on a seizure medicine, make sure your instructor remembers that, and you're the first to give meds that day. All right? Evaluation, have the number of seizures decline. And if it's Dilantin, is it within your therapeutic range? And I didn't make you learn your therapeutic range for Dilantin, okay? Patient teaching, should not drink alcohol with benzodiazepines. Also, smoking decreases the effectiveness of benzodiazepines. With Dilantin, that's your Dilantin. Be sure to have dentist checkups 2 times a year. Because remember, one of the biggest side effects if you're less than 23 is gingival hyperplasia. Teach the side effects of the class the patient is on. They should wear a medical alert bracelet saying they have seizure disorder. Liver function and kidney tests have to be monitored because they can both, you can damage the liver and the kidneys with these meds. Remember, your kidneys, your liver breaks down all your medicines, and the kidneys excrete them. Okay? Call the doctor for rash, fever, unusual bleeding, bruising, sore throat, jaundice, abdominal pain. All right. Unusual fever would be indicative of infection. Unusual bleeding, bruising is indicative of liver damage. Sore throat, what would that be indicative of? Infection. Jaundice or abdominal pain, what would those be indicative of? Liver. Better check your liver. These medications place older adult at risk for hip fracture if they're on them, so you need to remember that. And if patients don't eat enough protein, and you know, elderly people are prone not to eat enough protein because they can't afford meat or whatever, or don't like beans, the protein, just your serum protein level can get low. And if the serum protein levels get low, they can get, their dilantin level can get too high. With every medication, are you listening? This is a hard concept. With every medication, you have a certain percentage of that medication that binds to protein in the blood. Every medication, and it's inactivated. Okay? So, just hypothesis, I'm just making this part up. Let's say I give 10 milligrams of dilantin, and 2 milligrams of it binds with protein. They're actually only getting 8 milligrams, right? But if they don't eat enough protein where the dilantin can bind, that doctors and all know binds, then it doesn't bind, so you have an increased level floating around in your blood, and they can get toxic more easily. So you see the connection between proteins? And that's a pharmacology concept, straight from pharmacology. Okay, that's important. It's important, that's another reason it's important to eat proteins in the diet. Okay? And elderly people don't because they can't afford it. Now, look at your different classes, the ones we're doing by each class. Barbiturates, we're looking at phenobarbital, okay? Nembutal, phenobarbital, seconal, and they don't really have a generic name. I wrote your dosages in there for you because they're hard to find. All right, so just put those dosages on your cards. Under benzodiazepines, Klonopin or clonazepam, Transine or clorazepate, Valium or diazepam, Ativan or lorazepam. You're going to see a lot of Valium and Ativan, and you need to know them by diazepam and lorazepam. Okay? Adatins is your dilantin. Your generic name for dilantin is phenytoin. Succinimides is Zeritin, and there's your dose. The succinimide. And then just other drugs. They don't fit in any category. So these are just other drugs that are used for seizure control. Tegretol or carbamazepine, Neurontin or gabapentin, Depicon or valproic acid. All right. Now, Neurontin or gabapentin is also used in diabetic patients for neuropathy. Okay? So these other drugs, they don't really fit in a seizure category because they're used for other things. You're going to see gabapentin on a lot of your elderly patients at the hospital, and they don't have seizures. They take it for their peripheral neuropathy from their diabetes or their MS. Okay? Tegretol or carbamazepine. I take Tegretol or carbamazepine for numbness in my legs from my MS. Okay? So it has other uses and not just a pure anticonvulsant. Yes?
Now the dilantin, you said we can't give that. Is that even as an LPN we can't either, or just
You cannot give it IV push ever.
Ever.
Only RNs can give it.
Okay, gotcha.
Okay, you can give it PO,
Gotcha.
but you can't give it IV push because you've got to hook them up to telemetry and do all that jazz.
Okay.
So for gabapentin, can it be given for like muscle spasms?
Yes.
Cause they put my dog on it.
Yes,
Cause he's full of muscle.
yes, yes. Yeah,
He's currently on it.
I couldn't take it. I had real bad side effects, but yeah. Okay? Any other questions? All right, due next week. All right,